next question is, do you have any tips on daily sort of foot care?
Daily foot care. So always cut your nails, but not too short. Don't cut around the corners. Also depends on your kind of toe shape. And let me just do something. I think my phone is running. I'm on my phone. I'm going to charge this because there we go. Got some battery there. Cream. So cream your feet. Cream your feet very, very often, twice a day. And a urea-based cream is really, really good because it takes off some of the dead skin and then it really rehydrates the foot itself. Use a foot file, use a pumice stone to remove all the dead skin, and that will keep it nice and soft. Foot care. Use nail kind of rehydration, kind of ointments, oils, and things like that to keep the nails healthy. Don't wear nail polish for a long period of time because sometimes it can stain the nail, make it pink. Sometimes if you use really like bright colors like red, it can stain the kind of leave white marks in the nails, and that's never very good. And then what else can you do? Wear the right shoes. I think that's about it. Creaming your feet, cutting your nails, filing your foot down. Yeah, I think that's, I'm wearing good shoes. I think that's about it.
Mm-hmm.
Yeah. Have
And then-
pedicure every often. Yeah.
And then in terms of like nail varnish, like sort of what's long is too long? Just give us kind of like idea.
I would say summer is okay. When it's winter time, you should really let them breathe. And show them to the world because they're not supposed to be covered. They're kind of lie, the nail plate dead. But if you cover them for too long, that's when you can't see the nail, and then when you do pick up an infection, you can't see it, and then what happens is you take away nail polish and you're like, oh my goodness, what is going on? So I would say if you have infected nails, to take it off when you're not in an event or on a holiday, just kind of leave them out. And then winter times you don't need nail polish. Nobody sees your feet anyways.
True that. So a few months is good. Yeah. Okay. Next question. Could footwear choice affect the health? Oh, you answered this question already. I was going to ask affect the health of our nails, and of course you said not being too narrow, but seeing somebody ask this question, just would be great if you can re-emphasize that again.
Of course. So obviously if they're like, so if they're not the right size, it can hold the toes, but it can bang onto the nails.
Mm-hmm.
And sorry, so there's a baby here. What are you doing? No, I'm having an interview. Anyways, it's like, my husband is going crazy. Sorry about that. So there's other things that can happen to the nails. If the shoes are too tight, or you do sports, the nail can get damaged. That can lead to infection, but the nail can be thickened too, which is what we call onychoxic nail. So if you imagine your nail is this flat and then it gets really thickened, then it adds a lot of pressure onto the nail bed and it's really painful. You can also interfere with the nail matrix if your shoes are not the right, and then you have lines on the nails, which obviously weakens the nail structure, and then that can lead to secondary infections and pain and things like that. If your shoes are too narrow, especially there's a correlation between bunions and narrow shoes and ingrown toenails. So all of that increases the risk of ingrown toenails. So if it's not the right size, again, you can have ingrown toenails, and that's when the nail digs in and causes lots of complications sometimes and lots of pain. So when I see my patients, I sometimes when I think, oh, your shoes look too small for your foot. So I actually measure the foot, and I use just like a scale. And there's a ruler. I use many different devices because when I was doing my PhD, I was measuring the risk of nail deformity and toe deformity to footwear size. So my prediction was that if you wear really tight shoes, or you're not wearing the right size shoes to the foot size, that will increase your risk of nail damage, like onycoxic and stuff like that. So yeah, footwear is really, really important to prevent kind of trauma, prevent thickening of the nail potentially. Obviously, if you were born with thickened nails, it's not going to prevent it. But if you wear the right shoes, it could prevent a lot of complications in the nails too.
Yeah. Okay, that's very useful. Thank you. We did mention about the choice of sort of footwear in terms of like sort of footwear shapes, and especially toe box. And I think from our previous week session, and if you do need further advice on this, and like we would recommend you to kind of watch that back. And yeah, so next question. Do you see any correlation between age and foot conditions?
So it depends on what foot condition, but almost maybe children are less likely to have nail problems, bunions, and things like that. So I would say the older you are, you're more prone to kind of dry skin and hard skin, because your sweat gland doesn't release it. It's not working as efficient, and your skin becomes thinner, so you get more dry skin. Also bunions and claw toes, ulcers, infections as you get older, because you have other underlying problems like diabetes, rheumatoid arthritis, and things like that. In the kind of like 20s to 30s, 40s, 50s, nail problems, a little bit of biomechanics. Obviously, they're more active, right? So they probably have like calf muscles, heel pain, ingrown toenails, and things. But there is, as you get older, you can have more complicated foot problems that don't mend as well. And if you're older and your immunity is not that great, then maybe you can't have bunion surgery. Then you have to live with a bunion, which can, obviously, if you're not wearing the right shoes, then that can ulcerate, and then it becomes quite complicated. So I guess, yeah, there is a little correlation between worsening of the foot as you get older if you don't take care of it, and you don't take care of your underlying kind of health conditions like diabetes. The main thing in podiatry is diabetes.